to be the first user of the Harmony XL platform in India, and it's been a very, very pleasant experience and journey. I'd like to share with you why I went in for a platform. Before that, I'd like to acknowledge the effort that the Alma team has put in, from Arundhati to Mr. Raghav Kulkarni to their team of engineers, have put in to make this experience wonderful. They have been very prompt for all inquiries on, first of all, on the laser technologies themselves, the physics. Alma has its own specifics with their physics. They've had a very good team of Dr. Joseph, of course, their physicist, Dr. Zeev, and it is actually Dr. Zeev who inspired me to go in for the Alma technology, because Alma seems to keep coming out with a lot of new things all the time, and his patience in explaining the physics, and because I enjoy laser physics, really led me to convert into an Alma user. They've been very prompt in service. They've really helped out all our queries, and we've had the Alma XL, Harmony XL for 6 years now, and we've been adding probes. So if I share my laser journey with you, is that I first obviously started with hair removal. Many reasons. Hair removal is probably the most that was the first indication which really took off. It is also the most commercially viable laser to invest in. So eventually when I bought my own laser, it was with a hair removal laser, which also performed leg veins and photo rejuvenation. It wasn't an Alma laser. It was dedicated to these 3 conditions, by which I'd already worked on diode, I'd worked on Nd:YAG, but I invested in an Nd:YAG. When I had gained enough experience with the Nd:YAG and wanted to expand my horizons into other indications, I decided to go in for a platform for very simple reasons, and that is, which we all know today, but at that time while evaluating, it made a lot of sense to buy a platform to which you could add probes depending on the demands of your practice at that point, and also keep adding probes depending on how your practice grows. And so as the practice grew, as the indications grew, as the confidence grew with the machine itself and its physics and its technology and its deliverance of results, I have really enjoyed having added almost all the probes, and I've had very good results. Of course, there's a learning curve. Remember, there's a learning curve with laser physics. There's a learning curve with every company has its own specifics. So you must know your laser physics very well, and you must know the company's specifics so that you understand your particular device. And once you understand your device, then it's really a lot of fun. And you have to be cautious, but you can also be, and as you use it more, you will also be more confident and can even innovate. So I will just give them a little space. So when I got the Harmony XL platform, I decided to go in for the SHR probe, that's the super hair removal. I also picked up the Pixel, which is the ablative fractionated Erbium YAG 2940. I also picked up the Q-switched 1064 nanometer, and I also picked up the KTP 532 nanometer. And I also picked up the UVA UVB light probe that they have. And this is how I began. I also, at the same time, added the SSR and SST, skin rejuvenation and skin tightening probe. So this is what I began with. You'll be surprised as to why, after having a successful laser hair removal practice with an Nd:YAG, I had used a diode before, but eventually I opted for an Nd:YAG. And why did I go for an SHR probe is because of a couple of reasons, and these are practical reasons. Is because today, I've just come from ASICON, which was in Kerala, and there was a debate and a session on laser hair removal and which is the best technology. So obviously it is a diode versus Nd:YAG versus IPL versus SHR. This is where it is. Well, if you ask me, I have been in the laser hair removal business now 15 years, and I can tell you that all these technologies work very well for thick, dark hair, that we know. It's when you come and very soft vellus hair, none of them really are effective. So when it comes to patients of hypertrichosis with medium to dark hair, but not very thick, more like hypertrichosis, or patients who are very young, who are teenagers, and may be converting because they're still going through a hormonal flux, is that you have patients who somehow with any technology don't seem to respond. So there are many reasons for that, which I'll cover in my presentation. But I felt that I needed a technology which would help me in the medium, fine, not fine, but medium hair category, which were dark but not thick, not terminal hair. And that's when I've thought that adding an IPL in the terms of super hair removal with infrared. So this probe has a 785 to 900 nanometer wavelength. So it is infrared. There is also the Soprano. Now the reason I didn't pick up the Soprano was because the Soprano is a great machine. It's a workhorse. It has really no consumable. It's a great machine if you are also going to have a big laser to start off, and also if you have a good laser hair removal practice, and it's a standalone. At that point I wasn't really looking for a standalone. I already had one. I was looking for a platform, and I wanted to add super hair removal as an option to patients because it's also less pricky. It feels like a hot stone massage. So for some very fussy patients, I practice in South Mumbai, this was a very good option. And in fact, I think after that, Dr. Rajendran and I had a lot of chats on the super hair removal because you also picked it up. And we both we were one of the first few. And we have compared notes, and we've both been extremely happy with the super hair removal. And I'll share our data and experiences with you. At that time, tattoo removal about 6 years ago was not such a rage. At that time, tattoos were being done, not removed. Today, they're being removed, and we're mimicking the West. And so, I was really using the Q-switch for either freckles or some hyperpigmentation, photo damage, LPP, and once the LPP had settled down, for post-inflammatory hyperpigmentation, but in very low fluences. At that time, there was no fractionated technology for Q-switched. And the KTP I found, 532 nanometer, very useful for freckles, especially the ephelids, as we call them. Freckles, it has worked beautifully. I'll show you some of our results. And then slowly, as tattoo removal started, we were using the Q-switch for tattoo removal as well. And then when the new Q-switch, they brought out the new Q-switch probe, which is more powerful, we've got even better results with tattoo removal and with all the pigmentary conditions. And the last probe I added is their Pixel ClearLift. The Pixel Erbium YAG, which is the fractionated ablative Erbium YAG 2940, I found extremely useful for acne scars. And the reason I went in for an Erbium YAG versus a CO2 is that my patient profile, and that is one very important dictating force when you buy equipment, is what is going to work and appeal both to your patients. You may say the fractionated CO2 is the gold standard. I agree with you. Fractionated CO2 superior to Erbium YAG in giving results for deeper scars? Of course, because it penetrates deeper. But the risk of PIH downtime just doesn't go well with my patients. And that is why I felt that for me, an Erbium YAG, if I could skillfully use it, the fractionated ablative Erbium YAG would be a much better option in my practice. And by then, the non-ablative fractionated lasers had also come out. But I preferred to go in for the Pixel because it belonged to a platform and I didn't want to go for a standalone non-ablative. And if you